Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India. And in this video, we are going to be talking about 5 myths about bow legs. So firstly, you need to understand what is bow legs. This is your lower limb, this is the thigh bone, this is the leg bone, all right? This is where they meet, called the knee joint. Normal knees are when the body weight, that means if you connect a straight line from the center of the hip to the center of the ankle, it passes through the center of the knee. However, not everyone is perfect. You must have seen some people with legs like this or legs like this. Legs like this, where all the body weight goes into the inner part of the joint, are called bow legs. And why does it happen? It happens if there's any deformity in the thigh bone or the leg bone or in the joint. Most of the times it's because of a deformity in the leg bone. Myth number 1, bow legs affects only children. This is wrong. Bow legs can affect any age group. It can be found in children more often. However, adults can also have it. They may have had it since childhood or may have acquired it over a period of time. How do they acquire it over a period of time? Because if your knees are crooked and all the body weight is going through the inner compartment of your knee, even if it is slightly crooked, which is not initially visible, the cartilage gets eaten up, gets finished on the inner compartment of the knee, and the bones collapse on each other, which creates bow legs. So it can be seen in adults because of osteoarthritis, any injury like a fracture in the leg bone or the thigh bone that's caused a malalignment, and can occur in children. Myth number 2, bow legs are always caused by genetic factors. No. Bow legs more often than not can be genetic or growth related. However, they can happen due to causes after the child is born on earth. Most common cause being vitamin D deficiency and injuries to the bones, right? So when you have an injury to the bone may join or heal in a crooked direction, which can lead to bow legs. The other reason is vitamin D deficiency. Vitamin D is a factor that helps in calcium being absorbed in your body, and calcium is the building blocks for your bones. When calcium is less, the bones become brittle, become a little more flexible, so they can get crooked and cause bow legs. It can also happen because of injuries around the knee, loss of cartilage on the inner compartment of the knee leading to osteoarthritis and worsening of a deformity. So remember, genetics is not the only cause, it's just one of the causes. There are a myriad of causes that can cause bow legs. Myth number 3, surgery is the only way that can fix bow legs. Now, bow legs is an unscientific term. The scientific term is genu, varum. Bow legs is when you look at a knee and it looks bowed. Many times what you're seeing is not the reality. That's why getting an X-ray called a hip knee ankle X-ray is very important to see where the body weight is going. Sometimes what looks like a bow leg may not be. It may be straight knees. So beware of that. Second, sometimes in early ages, in children, bow legs may be there because of certain deficiencies. If we take care of those deficiencies and splint the leg, the alignment of the leg can get all right. So it can be treated in young children by not doing any kind of intervention. And remember, all of us are not perfect. When do you call something abnormal? You call something abnormal when it's beyond a certain limit. So a little bit up and down, a degree or 2 here and there towards knock knees, bow legs is considered normal. Whenever it's more than a particular degree, that's when we call it pathological. So if you're just a little bit here and there, all of us have a little bit of curvy knees, ignore it. You don't need anything. So no surgery for that. Myth number 4, bow legs are only a cosmetic problem. Well, not so. If bow legs are beyond a certain limit, we call them pathological. Pathological means they can cause problems later on in life. And very simple, I'll explain to you by this table. So think about a table. Table has 4 legs. Think one leg is a little crooked and you put all your stuff on that side where the leg is crooked. What's going to happen? The leg is going to collapse on that side. Same thing, when all the body weight is going through one part of the joint, because of overloading, the cartilage can go away there and you can eventually land up with arthritis. So it is not only cosmetic. When we fix these bow legs, it's more like a long-term investment plan so that you don't go in for a knee replacement surgery early in life. Myth number 5, there's no effective treatment for bow legs. Absolutely wrong. I make a lot of people every year better and fine who have bow legs. So bow legs is completely correctable. In children, we go the conservative way of trying to treat them without any intervention because the body's capacity to heal is good. There's a growth potential. So if it's a deficiency related problem, they may get all right without any intervention. However, in adults, there's no growth potential. It's like a set cement. When the cement is set, you can't restructure it unless you break it. So what we do is osteotomies, called a high tibial osteotomy or a femoral osteotomy, depending on where the bone is malaligned, leading to bow legs to make it straight. So they're great treatments. The HTO, high tibial osteotomy, the distal femoral osteotomy are great treatments and surgeries to fix bow legs. I hope through this video you understood a little bit about bow legs and I've managed to demystify a few myths about bow legs. If you enjoy my video, please like and subscribe to my channel and please follow me on Instagram. Thank you.